Okay, everyone. Thank you all for coming. Good afternoon. My name is Eliza Bowling. I am the Public Health Advisor for the Environmental Health Team here at National Indian Health Board. Thank you so much for joining my Tropical Environmental Health Summit's webinar series. Such a mouthful, I know. I'm joined here today with Miss Diana Van Vliet from the American Lung Association. She's been agreed to be our most gracious presenter for today, and I thank her so much. Our presentation today is on air pollution, and air pollution poses several challenges in tribal country, but also all over the world. Um, some landscapes and traditional lifestyles, particularly in indigenous communities, are also increasingly threatened by the encroachment of air pollutants, usually coming from both natural and anthropogenic sources. Traditional practices are sometimes disrupted as the pollutants infiltrate the air and impact the health of both the land and its people. Um, so that is why this webinar is extremely important to share this information and share information to you all. Miss Diane will be giving herself a brief biography, but if you do have questions, please put them in the chat. I will read them off at the end for Miss Diane to read off of them. And if you have questions or you have something specifically you need to say to me, then you can just message me directly and I will answer them as soon as I can. Do save questions like raising hands and coming off mute to the end so we can get through the presentation and then we can have a very good discussion towards the end. The floor is yours, ma'am.
Thanks so much, Eliza. Okay, let's see if I can get the slides to work. Okay, can you see my slides?
Yes.
Great. Well, thank you so much for having me. It was really fortuitous timing that Eliza reached out at this time because we at the Lung Association just put out our annual State of the Air report on April 24th. I should just say quickly, my name is Diana Van Vliet. I am a director of nationwide clean air at the American Lung Association. I work on our outdoor air pollution and climate change policy on the federal level. And it's an honor to be a part of this report, the State of the Air report every year. I'll jump right into it. So this report aims to really be of value to the general public and to everyone working on air quality issues, whether from the environmental health side of things, from the city and local government, from the tribal perspective, just giving more people more information about the air that they're breathing. So the report grades counties, on a through F scale, and also ranks cities based on their air pollution. And we specifically look at ozone pollution or smog, and both annual or year-round particle pollution and daily particle pollution, so like spikes in particle pollution due to events like wildfires. It's really important to note that, unfortunately, we don't have information for every county because we don't have a quality assured air quality monitor in every county, but we use all the EPA assured data that is out there. So I'll get into why we do this report at the American Lung Association. Of course, we care about the health of the lungs, and air pollution certainly harms lung health. It unfortunately also harms pretty much every other health system. It can cause, from the respiratory perspective, wheezing and coughing, shortness of breath. It triggers asthma attacks. It causes COPD exacerbations. It even causes lung cancer. And it causes a host of other health issues too. It causes early death, first and foremost. It can cause there's more and more research looking at the links with dementia and air pollution. It causes developmental harm for pregnant individuals and their fetuses, impaired cognitive function, metabolic disorder. So, and a host of other cardiovascular harm. So, we could go on and on here, but it really matters. It really matters for health. And everyone's at risk from breathing polluted air, but there are specific groups that face even higher risks. Communities of color, low-income communities, children, older adults, people who work outside, people who have lung and heart diseases and other pre-existing conditions. So it impacts someone in every family, we'd like to say, and really it's harmful for everyone, even healthy adults. So just some top line findings of this year's State of the Air report, which was actually our 25th annual report. We started this report back in 2000. So the report found that nearly 4 in 10 people in this country live in places with unhealthy levels of air pollution. And the burden is not evenly or equally shared. So people of color were 2.3 times as likely as white people to live in a county with 3 failing grades, or the worst and most polluted counties. The key messages in this year's report is, just reiterating the more than 4 in 10. So in total, around 131 million people live with unhealthy levels of air pollution, which is an increase from last year's report. We found that deadly particle pollution is on the rise, and there are some interesting disparities that have risen. I already flagged that there's people of color face disproportionate risks from air pollution as compared to white people. But in the past several years, we've really noticed a disparity between Eastern and Western states in air pollution. And I'll talk a little bit about that later, but that's really mainly contributed to climate change. Some other top lines here of the general trends in the report is that it's a great success story, because since we've been doing this report starting in 2000, we have seen overall air pollution levels really drop. And that's thanks to the Clean Air Act. We've been cleaning up industrial sources. We've been cleaning up cars and trucks and transportation. And a lot of the areas, particularly in the Midwest and the East Coast, which used to have the most pollution when we started this report, they've really cleaned up. But in around 2017, we saw air pollution levels start to pick up again. And in our report, that's really driven, in what we look at in our report specifically with ozone and climate and particle pollution, that's largely attributed to climate change. So we're seeing climate change drive more frequent and intense wildfires, which is spiking particle pollution from the wildfire smoke. We are also seeing, more heat, which can contribute to the formation of more ozone pollution or ground level ozone pollution. So, we've made great progress in cleaning up air pollution, but climate change is making this harder harder to clean it up, and it's making air pollution worse. Looking at some of the specific pollutants now. So I think the biggest, finding here was our daily particle pollution. And we're really seeing levels that are very disturbing. 65 million people are living with dangerous spikes in short-term particle pollution. And 19 of the 25 cities that are most polluted by short-term particle pollution had even higher particle days than last year's report. 7 cities of the 25 that I mentioned hit their highest number on record. So just what we're looking at here is, I think most people are familiar with the air quality index. So I remember growing up hearing, oh, you shouldn't go outside today, it's a code orange or a code red day. I think most of us know code yellow, code orange, code red. But we're actually seeing a really disturbing increase in code purple and code maroon days. And purple means that the air quality is very unhealthy. Maroon means that it's hazardous, extremely unhealthy. So it's not just the number of high particle days that we're seeing, it's the intensity of the high particle days. It's rising to levels that we've really never experienced before. And again, this is largely due to wildfires and wildfire smoke. You also see that when we're still on short-term particulate matter pollution, We're seeing this very starkly in the geography. So for the first time ever, all of the 25 worst cities for short-term particle pollution are all in the Western United States. And this is really largely because of wildfire smoke. Pivoting to year-round particle pollution, there's a kind of interesting thing happening in this year's report and in general. So after decades of advocacy from the Lung Association and other health and medical organizations and environmental organizations, and on the federal level, state level, we have a great victory of EPA just this February strengthening its particulate matter standard. As a result, and this is getting a little bit wonky, but our report found that many more people live in counties that got a failing grade for this year's report. It's even though, backing it up, even though we saw many more counties failing for year-round particle pollution this year as opposed to last year, this really means that these places have probably had unhealthy air for years. But the stronger particulate matter standards that we now have, thankfully, just allow us to more accurately convey the risk to people's health from the air that they have been breathing. The standards are previously not strong enough based on what the science said. So nationally, the level of annual particle pollution only worsened slightly, but as I mentioned, we have many more counties because of that new PM standard. And some of the most polluted cities saw their worst levels for PM ever. So I will spare you the specifics here, but you can dig in more on the state of the air report. So here is the top 10 list for the most polluted cities for year-round particle pollution. Again, this isn't just the daily spikes from things like wildfires. This is day in, day out, year-round, the levels of particle pollution. And you can see that it is mostly still West Coast, but we do have some East Coast cities in there too, farther down on the list. With ozone pollution, we saw mixed results. Overall, the ozone pollution levels, ground level ozone pollution levels have generally improved, but it is still the most widespread pollutant that we track. And about 3 in 10 people still live in counties that have unhealthy levels of ozone. So it's certainly not going away, but generally it is improving. For this year's report, we saw that 2.4 million fewer people were living with failing grades for ozone. But unlike the last year, when we saw big improvements in many places, most of the 25 most polluted cities for ozone got worse on average. So here's just a snapshot of the top 10 most polluted cities for ozone. You can see these are not coincidentally hot and sunny places that really struggle to get their ozone under control. Because when you have volatile organic compounds like VOCs and nitrogen oxides or NOx, when you have those come into contact with hot, stagnant air and sunlight, they form ozone. So these places are all making great efforts to reduce ozone, but the hot, sunny climates and climate change are making it hard to get their ozone under control. Here's a quick list of the cleanest cities. We have some pretty tough criteria to meet to make this list. You have to have 0 days for high ozone and 0 days for short-term particle pollution, and you have to pass for the annual PM standard. These are all veteran cities except Johnson City, Tennessee is new for the list this year. This year's report was also really an interesting one because it's kind of funky, but for state of the air, we use the 3 most recent quality assured data years. That's what we analyzed for the report results. So for this year's report in 2024, we looked at 2020, 2021, and 2022. We looked at air quality data from those 3 years. And all 3 of those years were COVID years. And I don't know if you all remember, but during the beginning of COVID, there was a ton of news about, how there's less traffic, fewer people commuting, if that would make a significant difference on air pollution levels. And, if any improvements that we did see due to behavior changes in the beginning of the pandemic or throughout the pandemic, as you heard from the report results that I just read, really have proven to be small and brief. So there has not been a significant change in air pollution due to, societal changes because of COVID. Having said that, more and more research has shown that there is an association between exposures to even low levels of air pollution and an increased risk of severe illness and death from COVID-19. So just a quick note on the website in case you're interested in learning about the air quality where you live or other report information. Most people who visit the State of the Air want to know state of their air. So when you click select location here, you can see the red arrow. You can put in either your state and look up your county. You can put in your zip code. And I'll just go into, this is a state page. You can sort by high ozone days. You can see we're on the ozone tab. You can sort by particle pollution. I'll say that for ozone and particle pollution, we only include information for the counties that have air quality data. Unfortunately, you can see right here that we're looking at the Illinois state page. Only 23 out of 102 counties have air quality information. However, if you go to populations at risk, that tab, we have information for every county, and none of this is our information. We just analyze this. Populations at risk is, I believe that's census data, and it gets into younger people under 18, people over 65, pediatric asthma, adult asthma. There's a lot of really helpful population at risk information from the environmental health perspective. And I'll just say you can sort by grade, you can sort by weighted average if you're in the state air quality information page. On the county and metro pages, because we also, rank cities in addition to grading counties. This is the Lake County, Illinois metro area page. You can see it received an F for ozone, and in a lot of different places you'll see DNC. That means did not collect air quality data. We simply just don't have enough information to assign a grade for that. We also have trend charts on our report, so you can see since we started this report in 2000 how the different pollutant levels have changed. So the top line, the light blue line, shows in this case annual particle pollution over time, and the darker blue line at the bottom, that is the line below or above which that's the annual standard. So you can see that the particle pollution is above the annual standard for this specific area around Chicago. Other sections of the report beyond air quality information, we have a lot of good information in here. So we have an updated look at the most recent science on air pollution and the health impacts of air pollution. We talk about populations at risk and why certain populations face greater risk. We also include recommendations for action, which I'll talk about in just a second. So quick important note about how we get these grades and how we do this report. We really rely on EPA assured air quality monitors. And unfortunately, we don't have enough information. We need more monitors in this country in general, but if we don't have air quality monitors, we can't grade. We don't have the information, and fewer than a third of the counties in this country actually have air quality monitors that are official EPA air quality monitors. And EPA and states and tribes decide which counties get monitors. We unfortunately don't make that call. So if we don't have data, we can't grade. Just an important note on air monitoring in Indian country. So tribes have the authority to manage air quality in tribal land. Unlike requirements for state agencies, there are no mandates for tribes to conduct air quality monitoring. Many tribes have been active participants in EPA's nationwide program, but not infrequently limited resources are spread really thin. tribal communities. That's what we've heard from our friends at the National Tribal Air Association, who put out an annual status of tribal air report. And unfortunately, limited resources can really have a negative impact in the sustainability of air quality work and environmental programs in general. So it's really important that we expand and sustain investment in air quality and environmental health programs for tribes, and in particular, Congress should increase funding for the tribe's air quality work. And we have a section specifically highlighting the status of tribal air report and air monitoring in Indian country in our 2023 State of the Air report. And we still, of course, any EPA quality assured information from tribal air monitors we absolutely use. But it's, we really need more funding for tribes to monitor the quality of the air that they have. So I really defer to the National Tribal Air Association on this. They do great work. So a little bit about our advocacy priorities in the report. Our advocacy call for this year's State of the Air report is that, we have made a lot of great progress. This administration has done a lot to clean up air pollution and address climate change, thankfully. But there's much more work to do, and we are urging EPA to set long overdue stronger national limits on ozone pollution, which would really help people protect themselves, know about the air quality that they're breathing, and drive the cleanup of ozone across the country. If you're interested in signing the petition or sharing the petition to call on EPA to strengthen ozone standards, we would love that. We have one at stateoftheair.org or long.org/SOTA. So just a little bit about what we have done as a nation. At the federal government level, there's been a lot of great steps, especially in the past couple of months. EPA has updated national particle pollution standards. They've finalized rules to clean up methane from the oil and gas industry, finalized stronger, cleaner car standards, stronger, cleaner truck standards, and final measures to clean up mercury and carbon pollution from power plants. Those are all done, which is great. In progress, we need to keep the Inflation Reduction Act that Congress passed, keep those investments rolling out, fully implement that, and work to address wildfires. I can talk a little bit about that in the Q&A if there's interest in that. The Lung Association does advocate for prescribed burning under the right conditions as a way to mitigate wildfires. And on the to-do list at the federal level, as I mentioned in our petition, we're calling on EPA to strengthen national standards for ground level ozone pollution. And we're calling on Congress to defend the Clean Air Act and fund EPA. We've already seen attacks from members of Congress on some of the great rules that EPA has finalized recently. For state, territorial, and tribal governments, there's also a lot to do, implementing EPA's new clean air protections, setting clean or renewable electricity standards or clean peak standards, prioritizing deployment of clean energy production, leveraging the IRA funding or Inflation Reduction Act funding, and for states, they can adopt California's stronger emission standards for vehicles. At the local level, adopting a climate action plan, purchasing zero emission fleet vehicles, and establishing purchasing goals for renewable non-combustion electricity. And then for individuals, knowing the air that you're breathing. I think it's always a good thing when you're checking the weather. Also check your air pollution forecast if it's not already automatically on your phone. And I think a number of weather apps are already starting to do that, which is great. But you can always go to airnow.gov. Reduce your own contributions to air pollution. I think our unofficial motto is, don't burn stuff. Try to take public transportation or active transportation where you can. Consider taking advantage of tax incentives to reduce emissions for your home and your vehicle, and show up at the local level. And I'll just say, how can you use State of the Air? Really, however you like. We hope it's valuable for you, and we'd love to hear feedback on what could be more valuable for you. We are hoping that it helps us on the state and local level. We have air quality information on a pretty granular level in many parts of the country, and we hope that that can help with public education, with advocacy. We have that petition that I mentioned. Share it with decision makers, highlight in social media, and really please let me know if you have any questions or any feedback. And that is it. So I will stop sharing my screen and see if there are any questions.
Thank you so much. As she said, do we have any questions? If not, I have prepared a few. But do we have any questions? I did notice in the chat someone asked, would the sessions be emailed? I can email them after the review of the webinar. For the most part, most of the webinars are placed on the NHB website in the next week or so. We are about to head into conference the week after next. So that is going to take precedent, but we'll get the webinar out to you guys as soon as we can. I did see a question from Julia. What are clean peak standards?
It's a great question. And quite frankly, it's not my exact area of expertise. So I do not know exactly for sure, but I know that generally peak demand is later at night. When people come home and are, watching TV and needing to use AC or heating. And generally that's also when solar energy is really high during the day and it falls during at night. So oftentimes if an area does have clean non-combustion energy on the grid, it's often not the clean, I'm doing a terrible job of explaining this, but generally utilities rely on non-combustion or non-clean combustion electricity during peak hours. So I think just finding a way to make sure that we're using clean non-combustion electricity at all times, especially when demand's at the highest level.
I do believe, just to follow up on that, it's a policy tool, basically just to promote cleaner energy for reducing air pollution, enhancing grid reliability, and I think a few other things. Obviously, also combating climate change. It reduces pollution and makes sure that the environmental agencies and organizations are controlling the pollutants that they do release during high periods of high demand, just to reduce it, control it mainly, but also to reduce it over time. But yeah, we could probably get more information about that later as well. Does anyone else have any questions? All right, well, I have a few written here and pull them up really quickly. What would you say could you explain the significance of the air report in monitoring air quality, and how does it contribute to the public awareness and policy making for it?
Great question. So we don't do any air quality monitoring ourselves. We rely on EPA and state and tribal air quality monitoring data. So just wanted to make that clear. But I would hope that it has been a useful tool for public education. More than anything, the Lung Association does. We get media hits on this throughout the year, every day. Across the country, we see coverage and citation of the Lung Association. This county got a C for ozone. We need to do better. We need to clean this up. Our city ranks 400 for particle pollution. This is unacceptable. We need to clean this up from X and Y, Z sources. So I'm hoping that it's we hope and we hear that it is a useful tool for our friends and partners in the health and environmental community and the environmental justice community. communities as well. But in terms of public education, we really try to put a lot of information in the report beyond just the grades and rankings, talking about how health is impacted by exposure to these pollutants and which groups are at risk. So, beyond just the media cycle, we use this report throughout the year to talk to different organizations, different demographics. I work on the federal team in the DC area, but we have state advocates and public health staff members across the country that use this report for public education tools.
Anyone else have a question? Otherwise, I will ask another one. Okay. Another question that I have. I know there were key findings and trends that were highlighted in the report. What I suppose, are the most, I don't want to say more important, but the most important, I suppose, findings, and how have those findings influenced the environmental policies and regulations, if any?
It's a great question. So I think a couple top line trends. The first is that the clean air policies work, and we see that at the national level because the Clean Air Act has dramatically reduced air pollution. I think it's easy to slip into doom and gloom. And I think that also we hear from industry over and over again every time the EPA proposes stronger pollution standards. It's too expensive. We can't do that. But we've seen over 50 plus years of the Clean Air Act that pollution levels have fallen dramatically. And it's a great success story. And at the same time, the economy has grown, and industries, has risen to the challenge. So I think one of the biggest takeaways is just that clean air advocacy and clean air policies are effective. They're working. However, the other big trend is that we face unprecedented challenges to air quality and to health in general from climate change. And we are seeing, unfortunately, in real time, the fingerprint of climate change in our air quality, from the wildfires causing just horrifying levels of particle pollution. And we're seeing this disparity between the Western states that are seeing these super high spikes in particle pollution, eastern states. And I'll just say one last point on that. I think it's really important to emphasize that even though we're seeing crazy high levels of particle pollution in Western states and this growing disparity between Eastern and Western states, it's not that wildfires are just a West Coast problem. As I'm sure folks on the East Coast know, and the Midwest, last summer, we had really awful, terrible, harmful wildfire smoke from the Canadian wildfires that traveled thousands of miles. So this is, air quality is being impacted by wildfire smoke across the country, and to say nothing of the devastating wildfires that Hawaii experienced last summer too. So it's not just a West Coast problem.
Okay, a couple more questions. This report, would you say there are trends that came out in this report that maybe um, were not on the last one, or maybe or were on the last one but just not as prevalent, were as highlighted? And if so, what could you speak to those?
The biggest change, beyond, just the continuation of trends like more short-term particle pollution, I think the biggest change is the dramatic increase in people living in counties that had that failed for annual particle pollution. And as I mentioned, that's because EPA strengthened the particle pollution standard, which was long overdue and really needed to be done. But as a result of that more, it showed that more people are actually living in places with very unhealthy levels of annual particle pollution than we previously knew or thought.
Okay, couple more questions. How do technological advancements such as air quality sensors or remote monitoring systems aid in like the tracking or the mitigation of air pollution levels? And what would be the limitations of these? If you have any thoughts on that?
Yeah, it's that's a great question. Clearly only about a third of counties have official air quality monitors. We need more air quality monitors. I think there are a number of local air quality sensors, like Purple Air is one example, that are really useful and can really tell us a lot more about the quality of the air we're breathing. We also have NASA's Health and Air Quality Applied Sciences team has a lot of satellite information on air pollution. That's super useful. I think the state of the air specifically uses EPA quality assured information, and right now they are not looking at using. Well, I shouldn't. It's an evolving space, and I think there's definitely a role for more air quality sensors and air quality information in general. There's definitely a lack of data.
Um, did your report discuss the impact that air pollution has on like wildlife and ecosystems, and what would be the long-term consequences of the biodiversity? And if so, could you speak to it?
We don't look at that in our report. As the Lung Association, we really focus more on lung health and health impacts in general for humans. But I can definitely say that climate change is very harmful for biodiversity and ecosystems. And but I'm unfortunately not an expert on that, and the report doesn't touch on that.
Understandable. Would you be able to speak to the role that regulatory agencies and other environmental organizations play in the monitoring and addressing of the air quality issues? And how they collaborate with other stakeholders to implement change?
Sure. I mean, a huge role. I think seeing the Clean Air Act implemented over 50 years has resulted in enormous health benefits and pollution reductions. And we wouldn't have that without a lot of hard work from the agencies and Congress for creating that in 1970, and staff at EPA for implementing that, and from advocates in the health space and the environmental space for pushing agencies and holding them accountable to set standards based on what the science says is healthy for humans and not what industry says is doable. And I think we, as more science comes out, it shows that pollution is more harmful than we thought. And I think there will always be a role for agencies and advocates for making sure that our environment is healthy, not just in the airspace, but water, across the board.
Okay. Final question. How can education and outreach initiatives raise public awareness about the importance of reducing air pollution and promote sustainable policies and behaviors?
I'm so sorry. The sound actually cut out for a second could you read that again?
Sure. Can you hear me now?
Yes.
How can education and outreach initiatives raise public awareness about the importance of reducing air pollution and promote sustainable policies and behaviors?
Great question. So I think I think there is even a little bit more of a basic need for public education around air pollution in general still. I mean, the Lung Association has been working at it for a long time, and I hope that we've made strides, but I think one example of a gap was from the wildfires last summer. I live in Virginia, and a lot of my friends and family had no idea that wildfire smoke was bad and didn't know what to do if it was bad. How do you function if the air outside is unhealthy? So I think there's a lot of education needed for the public on why air pollution is harmful, how they can tips to help protect themselves, and then how they can not only protect themselves but advocate for stronger standards. And I think that there's, yeah, I mean, I know that the Lung Association has petitions, has fact sheets, has tries to make it as easy as possible for people to, you know, testify at hearings on relevant rules. So I think there's education is really important, and making it as easy for people as possible to engage in advocacy, because I know people are busy and have a lot going on. But yeah, just taking away the as many barriers as possible.
Well, thank you so much for answering all my questions. I don't see any more in the chat, so um, I think we'll call it. Thank you so much. Thank you all for attending. Um, the air pollution webinar will be ending soon. Just to let everyone know, please fill out the evaluation form in the chat at the end, just so we can make the next webinar better. Speaking of the next webinar will be on May 15th, and it is on solid waste management. And following that will be the rescheduled brownfield redevelopment webinar on the 29th, both of which start at 3 p.m. Eastern Standard Time. Thank you so much for coming. You all free to go.
Thanks, Eliza. Thanks, everyone.
Thank you, Ms. Hannah. Have a good day, everyone.